Hello friends, I am Dr. Mamta Sood, Professor, Department of Psychiatry in AIIMS New Delhi. Today we are going to talk about a mental illness which all of you know and hear about. It is called bipolar disorder. So we call this illness bipolar because essentially it has two types of episodes: mania, where a person feels extremely happy, and depression, where a person feels extremely sad. Some patients may experience only one or many episodes of mania, and some may have both types of episodes. That means depression as well as mania. So if we talk about what are the symptoms of these episodes, so let's first look at symptoms of episodes of mania, which are: the person may feel extraordinarily happy without any reason. So person may be very energetic, may talk a lot, consider himself or herself very important or powerful, like a god or a very powerful leader, may make unrealistic plans, may socialize excessively even with strangers. They may go and talk to people walking on the road. They may wander around. They may spend extra money. They may be very much interested in sex, and most of them, they sleep very little and feel very energetic even if they sleep very little. Such behavior can lead to strained relationships with significant people around them. They may suffer financial losses and may have legal and other problems. So now if we come to the episodes of depression, so these are exactly opposite of symptoms of mania. For example, the person will feel very sad, and which is unexplained without any reason. Sometimes people may feel irritable. They may complain of extreme weakness and may feel fatigued all the time. They may be on the bed all the time. They may also lose interest in any activities which they used to like. There may be sleep disturbances. They may sleep late or may get up early in the morning. They will have poor appetite. They may not feel like eating anything. They may also have low self-confidence. They may have negative and depressive thinking, like they may feel that their future is bleak. They feel helpless. Nothing can help them. They have no hope. They may blame oneself without any reason, and sometimes they may have suicidal thoughts. Bipolar disorder affects about 2% of the people, which means that if you walk on this road and meet 100 adults above 18 years of age and ask them, that means 2 out of 100 people will have bipolar disorder. And there is common misconception. People say we have mood swings, and that is bipolar disorder. So mood swings are not bipolar disorders. Mood swings can be a symptom of many mental disorders. It is not a disorder in itself. Now coming to the diagnosis, which is very interesting. Many people ask, do we have a test for diagnosing bipolar disorder? So no, we do not have. We don't have something like, say, CT scan, blood test, lab test, urine test, which will diagnose bipolar disorder. So when you go to a psychiatrist or any physician, they will diagnose bipolar disorder based on your history, which they will take in details and physical examination and mental examination. So when you come to the treatment of bipolar disorder, there are two important pillars to it. One is medication, which is very important, and therapy. So if somebody asks me, so medications are right hand and therapy is left hand. So both are needed. If we talk about medications, the most important medications for bipolar disorder are mood stabilizers like lithium and valproate. They help keep mood stable by balancing the brain chemicals. These medications are used to treat an episode. What is more important, the mood stabilizers will also prevent future episodes. As we know that this illness is episodic. So it comes in episodes. So to prevent future episodes, you have to take mood stabilizers. For severe manic episodes, sometimes we use antipsychotics for the treatment for short period, and antidepressants are used sometimes for treating depression. So what happens after treatment? First, sleep, appetite improves, agitation improves, and this is followed by mood improvement, and then thinking improves. So negative thinking and high thinking goes last of all. Antidepressants take at least 2 weeks to show effect, and the treatment for mania starts showing improvement in 3 to 4 days. In severe cases, hospitalization may be needed to ensure the patient's safety and proper treatment. Otherwise, patients can be treated at home with treatment. The most effective psychotherapy for bipolar disorder is psychoeducation. Psychoeducation for patients and their families. What do we mean by psychoeducation? Giving full information about every aspect of the illness to help plan for managing it. Before ending the video, I would like to share with you 4 simple tips to prevent the illness from recurring. First, take medications regularly. Second, get 8 hours of sleep at night and avoid shift jobs to maintain a stable routine. Third, avoid alcohol, smoking and drugs like cannabis. And fourth and last is recognize symptoms of your illness. So when the illness will come back, it will come back with the same symptoms. So it's important to recognize the symptoms, to identify it early and seek timely treatment. So remember, along with physical health, it's important to take care of your mental health. It is your greatest asset. Thank you. Namaste.